Good afternoon, everyone, and thank you for joining us for the Medical Board of California Midwifery Advisory Council meeting. This meeting is being conducted via WebEx. Public comments will be heard for each agenda item for individuals wishing to do so. In order to be ready for public comment, we ask to please ensure that your comments can be heard clearly by being connected to the audio of this meeting through the proper method. If you're having difficulty hearing the audio of this meeting, it could be because the device you're connecting with has bandwidth limitations. If you do have difficulty hearing the audio of this meeting using your device, please click the ellipsis button at the bottom of the WebEx application or the audio and video menu item at the top of the WebEx application and then select Switch Audio. You'll see an option to call in and will be provided with a telephone number, access code, and attendee ID that can be used to connect to the meeting audio via phone. Using the information provided, it will automatically disconnect your device's audio and connect your phone to the name you joined the meeting with. By using this method, if you are having audio problems with your device, this will allow you to still participate and hear the audio of the meeting. Please see the instructions on how to connect link on the last page of the meeting agenda for step-by-step WebEx instructions, including screenshots. Thank you, Ms. Weisner. You can now start the meeting.
So good afternoon, everyone. I'd like to welcome you to the Midwifery Advisory Council meeting. My name is Madeline Weisner, and I'm the chair of this advisory council. Since this meeting is being conducted via WebEx, I will ask all MAC members and speakers to announce themselves by name, especially if we can't see you, before speaking for clarity of the official record. All MAC members are able to unmute themselves to speak during the meeting. Please place yourself back on mute when not speaking to reduce background noise for all participants. Following such online meeting etiquette will ensure the best quality audio for everyone. During each call for comments from MAC members and speakers, we will ensure that all comments can be accommodated, are heard before proceeding with the agenda. During each agenda item, the host moderating this WebEx event will activate the Q&A and hand-raising features of WebEx, and will ask anyone wishing to make a public comment to indicate so by replying yes in the Q&A window or by using the hand-raising features. The host will then call on individuals who indicated they wish to make public comments by name. When called upon, the host will unmute the microphone of the individual and they will be able to make their public comment. After the comment, the individual will be placed back on mute. Please see the agenda for WebEx instructions on how to connect from the link on the agenda and additional instructions. The board's IT staff will assist me with receiving the public comments via WebEx during the meeting. Will be done by roll call vote. So this means that once a motion is made and seconded, Ms. Moriarty will call each of the names individually to request our vote. I would now like to call the meeting to order and ask that Ms. Moriarty please call the roll.
Keith Freeman.
Here.
Dr. Kenneth James.
Here.
Tamara Robertson. I think you might be on mute, Tamara.
Here.
Thank you. Mason Wilson Teneb.
Present.
Thank you. Madeline Weisner.
Present.
Thank you. We have a quorum.
Awesome. Thank you. A quorum's present. Moving to agenda item number 2, which is public comments on items not on the agenda. And I would like to welcome public comment at this time.
The
Ms. Weisner, Ms. Robertson, are you able to turn your camera on? I know that Ms. Weisner was having a technical issue, but the expectation is cameras will be on for the MAC members. Ms. Robertson?
Yes, I'm attempting to turn on the video right now.
See the video icon, but the video hasn't started yet. The warning indicators indicating that there's a bandwidth issue. There we go.
Okay, Sean, thank you.
Thank you, Carrie. Anyone on the public end wishing to make a public comment, you can do so now by just typing anything into the Q&A window like yes as suggested earlier. You don't need to type in your whole question in there, as we'll call on you and let you ask your question that way, or you can use the hand raising feature by hitting the little hand icon down at the bottom of the screen. First request here is from Rosanna Davis. Rosanna, you should be receiving a request to unmute.
I'm president of California Association of Licensed Midwives, and I just wanted to say hello and welcome, particularly to the new members of the MAC. Thank you very much for your service.
Thank you very much, Rosanna. Next up here, we have Raphael Newport. Raphael, you should be getting a request on your end to unmute.
Thank you so much. It's amazing to get to see some faces of folks that I get to only see names most of the time. I am a former doula turned midwife and still working towards my licensure. And I attended this meeting today because I just wanted to just put forth a couple of concerns. One of them being that the midwifery, the medical board website for midwifery, as it pertains to the advisory council, is pretty sparse. So I am hoping that we can include more information about what the advisory board does, who the members are, what their roles are, so that can be easily distributed to students and constituents throughout the state. The other piece was that I would love to see increased diversity for the advisory board, not just BIPOC, which stands for Black, Indigenous, People of Color, but also LGBT+, other abled students, marginalized people across the board. And when I speak of BIPOC, I'm specifically speaking to folks who are aware of anti-Blackness and how it shows up in the work that we do. And then also just hoping that at some point the advisory board can take a look at when I know that the role of the board is around licensing and enforcement, but it would be lovely to see some more agenda items that look a little bit deeper into how the midwifery practices and laws that currently exist, how they impact practicing midwives within California in ways that we can make improvements. And finally, I do have a concern that our chair, Madeline, I believe, is no longer practicing in the state of California and may no longer live in the state of California, but I'm not 100%. And my part of why I would like to learn a little bit more about roles and things like that is to better understand how someone gets chosen and what are the requirements to be on the board, because I would, in particular, would want to see a chair who is either serving and or living in the state. Thank you.
Thank you for the comment. Just checking the Q&A window here. This time, Ms. Weisner, I don't see any additional requests.
Thanks everybody for your public comment. I wanted to move to agenda item number 3, which is approval of the minutes from the March 30th, 2023 Midwifery Advisory Council meeting. Are there any additions or corrections to the March MAC meeting minutes from the members? May I have a motion to approve the minutes from the March MAC meeting as submitted?
I want to say I know that the majority of you were not on the MAC at the time, but there is no prohibition to you making a motion, a second, or voting to approve the minutes if you're so inclined. Thank you.
Motion to approve.
Thank you. I'll second, if that's allowed. Yeah. Thank you. All right. Is there any public comment on the March MAC meeting minutes?
The Q&A window and the hand raising features are still enabled. Anyone wishing to make a public comment, please go ahead and indicate either way. I'll give you a few seconds to queue up just in case. Okay, I'm not seeing any requests at this time, Ms. Weisner.
Awesome. Ms. Moriarty, can you perform the roll call vote, please?
Yes, Faith Freeman,
Yes.
thank you. Dr. Kenneth James,
Yes.
Tamara Robertson,
Yes.
Mason Wilson Tanev,
Yes.
and Madeline Weisner.
Yes.
Thank you.
Okay, the March 2023 MAC meeting minutes are approved. Moving to agenda item number 4 is the report from the Midwifery Advisory Council Chair, which is me. I have very few things to report as the last MAC meeting was in March of last year. So it's been a while, and it's really been even longer since I think anyone has felt a sense of productivity from the MAC or feeling like we're doing something other than spinning our wheels. So I am really, really grateful to everyone who is here today. I'm very grateful to and I want to welcome our 4 new MAC members. I would like to welcome Faith Freeman, who's a licensed midwife, Dr. Kenneth James, Tamara Robertson, who's our public member, and Mason Wilson Tanev, who is another licensed midwife. So the entire MAC has turned over since I joined. And I feel like this gives us a really good opportunity to get through some of our more commonly held grievances about licensed midwifery in California, honestly. So I also wanted to express my gratitude to the medical board staff who continue to work with us and continue to work with all the LM stakeholders to do the best that we can given the position of the MAC as a non-regulatory entity. And I just want to say thanks. Like, it's been tough. I do not live out of the country or the state currently. I'm in Sacramento, California, right down the street from you guys. So I look forward to working with the MAC to really center the needs of the clients that we serve and of the midwifery profession in California. I think we're onto something really cool. The medical board does continue to be supportive of an independent licensed midwifery board. So I want to remind you of that. They're with us on that. They're actively working with COM on helping us out with that as much as is possible in the bureaucratic mess of California. So that's my update. We have a really packed agenda. I want to respect everyone's time. Questions or comments on my report from anyone? Public comment?
The hand raising feature and Q&A window are open. Anyone wishing to make a public comment, please go ahead and indicate so. Give you a minute or two to queue up. A few seconds here to queue up at least. And not seeing any requests, Ms. Weisner.
Awesome. So moving to agenda item number 5, establishing goals for the Midwifery Advisory Council. This seems like it's been an agenda item for the Midwifery Advisory Council as long as I have been attending births in California. So does anyone have suggestions or discussion on what our goals should be this time around? And there will be opportunity for public comment. I'm intrigued to hear what members of the public really want out of the MAC as well.
Do we have a list of previous goals from the previous MAC team? Do we have any sort of reference, like?
That's a great question.
I'm checking the meeting minutes. I thought that we may have had them in the meeting minutes. Just give me 1 second.
I will say historically, it's like create a strategic plan or create a strategic plan for creating a strategic plan for the goals. The goal of the medical board is, of course, consumer protection. Their goal is consumer protection. If we would like, we can have, we can have discussion about this. I guess I would first ask, can anyone provide an explanation of what the MAC is here to do at all? I'm wondering if Ms. Webb could catch everyone up to speed on the MAC. Not to put you on the spot, but
Sure, no problem. The purpose of the MAC is to advise the medical board on midwifery related issues. This can be on a variety of issues, including taking positions on bills and sharing the MAC's position with the medical board to help educate them on how a bill or a proposed regulation, for example, could impact midwifery practice. Other issues can come up. I know that there's a number of issues, for example, listed on this agenda that impact midwifery practice, where the MAC could advise the medical board on barriers, potential solutions, but certainly the focus needs to be on consumer protection and access to care. I hope that's helpful.
super helpful. So to clarify, the Midwifery Advisory Council is not a regulatory body. Its intention is to communicate the needs of midwifery stakeholders to the Medical Board of California by way of like the chair's report at the quarterly board meeting.
Yes.
So so that's really great. This is a communication tool. So I guess my next question here is what concepts do we want to be communicating to the medical board about licensed midwife practice and licensed midwife care in California? If we need a prompt for what these goals could or should be. Does anyone have any input?
Hi, Ms. Weisner, it's Mason speaking. Please forgive me as this is my very first meeting and I'm still coming on board here. My question has to do with how the information around enforcement of midwives is compared to the enforcement of non-midwives by the medical board. If anyone has studied that and what conclusions can be drawn from that quantitative analysis, and if anyone has undertaken that in the last few years.
It's a really good question. And perhaps we can get information about the use of licensed midwife fees, like licensure fees. I think that would be one of the ways that we could get, at least solicit information from the board about where our licensure fees are going and what type of enforcement processes are being done, because it's all very dubious, right? It's mysterious unless you're the one being investigated. I do know that COM has some information about that as well, and they've taken a closer look into it. So shall that, I mean, I'm happy to add that to our list of goals, just to clarify information from the board, as well as provide a recommendation to the board from the MAC on how these enforcement processes are working.
Yeah, I think that investigating parity, and if there is a lack of parity, investigating why there is a lack of parity is really would be really vital information for the medical board to have, and vital information for the MAC to provide.
Yes, absolutely. It might also benefit us to improve the LMAR. I know that that's been a suggestion, and we're going to be hearing more later about the LMAR, but improving the process by which data is collected from licensed midwives throughout the year, and if we can collect additional data or clarify that process and make it a little more accurate, more reliable, more specific. What other suggestions? With these goals, my goal would be to have our agenda work in honor of these goals, you guys. So it's not just going to be me, though. Do we have any public comment? Would it help to provide the list of previous goals in next meeting's agenda materials? I think we're allowed to do that.
Yes.
I have a, okay.
I was just going to go over what we have as our goals and what they were at the March meeting. And also, many of these goals are on the agenda, on this current agenda. We had Medi-Cal issues, LMAR reporting language, issues with birth registration, where to go with the MAC, and access to newborn screening equipment.
Faith, I see your hands up. Ms. Freeman.
Hi, yes. Can you hear me? I would just want to add to the goals and, future things that the MAC is focusing on. That was briefly touched on in the last few minutes, of just like the access to care here in California and ways that could be supported and improved. Because I feel like that's a huge part of the midwifery as a whole. And so that could be something I would like to add as one of the goals.
Awesome, thank you. Ms. Wilson-Tenev. You are on mute.
Thank you. I think I know how to do this by now. Ms. Moriarty, would you be able to share the goals from the last meeting with the newer panelists? Maybe email or some way to share that, and that would be helpful. And not to be a dog with a bone here, but back to the goals, I am very curious how the hospital reporting statistics are used, and if they're used as part of enforcement, and how the MAC reports that and integrates the conversation with the medical board around those hospital reporting statistics. Could you give me a little bit more insight?
We're going to be getting information from the enforcement program today. So I would say that that is within that agenda item. But yes, we all want that. And we can absolutely loop in HQIU, the entity that does these investigations and the enforcement, and see if they could potentially like do a more thorough walkthrough with us. Do you think that that would be helpful with the MAC?
Well, I think would be helpful, but it's not information analysis that I'm really looking for, but how the information is used. I don't feel like I have any clarity either as a member of the public or as a panelist on how that information is used. And I think that the public deserves some clarity about how those mandatory reporting forms that the hospitals fill out for midwives are actually used and whether or not they're used in any enforcement capacity.
Yeah,
At the
understood.
next meeting, we will be having a presentation on the enforcement program by a member of the medical board.
And will that include the hospital reporting statistics and how those might be integrated into enforcement, Ms. Moriarty?
I don't have that information in front of me right now, but I will check on that.
Wonderful, thank you.
You're welcome.
I do know that also COM is in talks with CMQCC about what, if anything, they're doing with the page 2 that is sent to CMQCC to collect data. I would encourage you to grill the enforcement department at the next meeting. You have my support with that. And to get part of what the MAC is useful for is to get clear information on the record and have them say it out loud, what they're doing with that form.
Terrific. And
Yes,
to that end, could I reach out to you or Ms. Moriarty to access more information about what we know about this now? What's some background so that I can have some clarifying questions to ask next time?
yes.
Okay.
I would think both of us would be happy to.
Oh no.
Okay, wonderful, thank you.
My headset just died. I have the cord.
Ms. Wilson-Tanev, your audio is still coming through. So I might have automatically switched to your device's audio or something, just to let you know. Sound like she maybe
That's
walked away.
me, Mr. Eichelkraut. There's no audio in my background at all.
Someone's looked like sorry, someone's audio is still coming through. Everyone's on mute now though, so it's okay. Sorry about that. Just wanted to make them aware.
I wonder if it's within the scope of the MAC to have like a MAC have a stated charter that we vote on that lists out these goals and commits the MAC to trying to accomplish those goals rather than resetting the goals every meeting. Is there a way we could do that?
I'm actually thinking these sound like future agenda items that come up regularly. So I think
We sure do.
yeah, we should rethink this item for the next MAC because it's going to be repeated for future agenda items.
Awesome.
And you know, it's really a matter of the MAC members moving their goals forward to the extent that they can within, you know, the confines of the law.
Right.
So I appreciate you know, all the goals that the MAC members have. I think there will be, you know, when we talk about the enforcement numbers, you know, we may be able to address some of the comments that have come up at this meeting. And, you know, we'll should rethink, as I said, this agenda item.
Sure.
I just assumed that the committee was for, keeping licensure, making sure that all the licensed midwives are keeping up to date with their policies and procedures and following the rules of their license, and then making sure I mean, as far as like, marketing and advertising and things like that, I assume that was not part of the committee. But if we wanted to be part of the committee, that'd be kind of a cool thing as well. But that's my understanding, was just to make sure that that licensed midwives are keeping up with their standard practices and making sure nobody's not too many rogue outliers are going to affect the quality of the care. That was my understanding, but I'm happy to continue with whatever goals the committee wants.
So to be clear, we're a council, not a committee. We're an advisory council, and we're not involved in discipline here. We're not involved in enforcement here at all. We wish that sometimes that would be different. Many MAC members have expressed that if we had any control over the midwifery profession other than our own individual practices, that would be cool, but that's not what the MAC does. It's more about consumer advocacy, consumer protection, and communicating with our regulatory body, the medical board, about what we need. So
Okay, sounds good.
it's
Fine.
It's wild, right? Do we have any other comments on this agenda item from members or questions? Would it be helpful for us to, I assume it would be Ms. Moriarty, to send out print materials to the members, like a member orientation document?
Yes, I'll be scheduling orientations with the new members. I did send out the administrative procedure manual, but we will be scheduling orientations with the new members.
Awesome. Cool. Thank you. I think that'll be helpful. I'd like to open public comment for this agenda item.
The hand raising function and Q&A window are open for anyone wishing to make a public comment. I've had a few individuals type their whole question in there. No need to do that. Save you the typing time. We'll go ahead and call on you. You just have to indicate you'd like to make a public comment, or just type yes or anything in there, and we'll go ahead and call upon you. First up here, we have Carla Michael. Carla, you should be receiving a request there on your end momentarily.
Typed it in. I didn't realize that the person speaking was the panelist, so I was confused as to how she was able to speak when I had a question, but I understand now. Thanks.
Okay, no problem. Great. Next up here, we have Andrea Ferroni. I hope I'm pronouncing that correctly. You should be receiving a prompt there on your end.
I'm sorry, can you hear me?
We can. Please go ahead.
I typed mine because I didn't want to lose my train of thought. This is going back to the question of, ideas for the goals of the MAC. I'll just read what I wrote. To proactively identify and address barriers for the licensed midwife, licensure, retention, and working to the full scope of their licensure, and being fully utilized for birthing people who want licensed midwives as their primary perinatal provider, and to communicate these barriers and to make recommendations on how to mitigate them to the state agencies that have the ability to change those barriers and challenges. Another goal I'd like to see that kind of relates to the transports and also license the LMAR is to align data collection measures and methods for licensed midwives with other nationally endorsed perinatal quality metrics that everybody else uses, and not to have an odd subset that just applies to us. And I was still working on how I was going to say this, but to align data collection about midwifery transfers and transports with how that data is collected for other providers and other, neonatal transfers and transports to different levels of care and maternal transports to roll our data collection into however those things are happening with other provider types. That's it.
Thank you very much for your public comment. Next here we had Rosanna Davis. Rosanna, you should be receiving that prompt on your end.
Yes, hello, Rosanna Davis. I wanted to remind folks that it is a council, and therefore anything that goes on the agenda has to be pre-approved by the medical board. So I would agree that it's really important that the MAC members get their onboarding. And I think the only thing I would add is perhaps it might be helpful for the MAC chair or someone to be annually giving a presentation to the medical board about the practice of midwifery, because ultimately it is the medical board who regulates us and does discipline for our profession, and holds all the regulatory authority over us. And it would be helpful if they had some working knowledge of our profession.
Thank you for your public comment. Just double checking here by this time, Ms. Weisner, I don't believe there are any additional requests. Keep on.
Awesome.
Yeah.
Thank you, everyone. Moving to agenda item 7, I am to present from the task force on Medi-Cal related issues. Task force needs members. I'm the only member right now. I think we can have two or three of us. Two of us?
Yes.
What a force. Okay, so my Medi-Cal update is that there is an interdisciplinary group of midwives, led by midwives, but which incorporates members of Department of Healthcare Services, as well as some of the managed care Medi-Cal plans, as well as other policymakers involved in midwifery, promoting midwifery care in California. This group is called the Midwifery Learning Collaborative. It was initially funded through the Institute for Medicaid Innovation, but it is going so incredibly well and has made so much progress that the timeline for that group is closing, and we are choosing to continue that that experience. For licensed midwives, the important update that I wish to communicate is that we have Department of Healthcare Services ear about enrollment, as well as about being able to bill for the full scope of practice of licensed midwives, so that the department can actually be providing this benefit, which has been a covered Medi-Cal benefit since 2015. So there has been a lot of improvement on the licensed midwife benefit for Medi-Cal. I was interviewed by the press, and the press made a press story about how I was forced out of the country. I'm in Sacramento still. It's a news story, and we all know what that is like. the timing of the Medi-Cal providers who have closed their businesses because they could not get reimbursed by Medi-Cal, that has been the force behind improvements in the Medi-Cal program for licensed midwives. So I do not want to discourage midwives from enrolling as providers. If anything, I want to encourage them and let them know that there are resources available to help make a practice that serves Medi-Cal families sustainable. I also want everyone to know that the Midwifery Learning Collaborative really is the place for that. And so if one other member of the MAC would like to join the Medi-Cal task force, what will happen with that is that we likely will be deferring to the MLC on a lot of those more specific policy changes. However, I do think it's good for the MAC to communicate with the medical board that the root of this issue is the oversight of the medical board. It's that midwives should not be regulated by doctors, full stop. So if we are to be pursuing Medi-Cal issues through the MAC, I don't think that will be sufficient. So my true recommendation would be to not have a Medi-Cal task force with the MAC, but that's because I'm the one person on it and I have enough things to do and enough irons and enough fires. If others would like to be the Medi-Cal task force, you have my full support though. Does that make sense? Do we have comments on this? Any public comment?
I believe, well, I saw a panelist hand up there. Did you want to, does anyone, any panelists have any questions before we go to public comment or comments?
Ms. Weisner, if your recommendation is to eliminate the committee, should the committee just be eliminated and this topic booted to the Learning Commission?
That would be my recommendation, and also to invite the MLC to come and present at the MAC as a future agenda item.
Okay.
If anyone wishes to make a public comment, you can do so by typing anything into that Q&A box or using the hand raising function. We'll call on you as we see you. First up here, I see Carla Michael. Carla, you should be receiving that prompt again on your end.
Hello there. I don't know if this is the time or place for this, but can you talk more about this Medi-Cal task force? You're saying you're going to disband it and it should be through the Midwifery Learning Collaborative. What is the Medi-Cal task force? Is that in regards to reimbursement for licensed midwives or just birth centers, or can you talk more about that?
Am I able to respond, or is it okay with everyone if I respond? Or
There's not a back and forth with public commenters. As the chair, it's your prerogative if you have something more to say.
right, the Medi-Cal task force through the MAC was established by members who are no longer on the MAC. And currently I'm the only person on the Medi-Cal task force with the MAC. And I really work all day and all night on Medi-Cal stuff, and would prefer to channel that energy into a more productive form. So it's not that any support of families with Medi-Cal are is being abandoned. On the contrary, I would say the Medi-Cal task force is a duplication of efforts and would be better. It would be time saving and resource saving for the MAC to focus more on general consumer protection and communicating findings of other entities doing this work already and doing it very well to the medical board, rather than having us having it all be under the roof of the MAC. So hopefully that is clear.
I'm sorry, Miss Mike, only one comment is allowed per agenda item. So I won't be able to call on you again there. And then this time I don't see any additional requests in queue.
Okay, shall we move on to agenda item number 9, which is, no, agenda
sorry.
item number 8, excuse me. Ms. Moriarty has a program update.
Ms. Weisner, we skipped number 6, the written update on midwifery related legislation and sunset review. It's an item that was submitted as meeting materials.
Oh boy.
That's okay. We can go back to that.
Great. Let me find it. Written update on midwifery related legislation and sunset review. Did I do that? Oh,
No,
boy.
that was an item
Good.
submitted by Aaron. Yeah, that was an item submitted by Aaron Bone,
All right,
and
thank
it was
you.
submitted as materials.
Okay, thank you. Swear to God, I know what's going on. All right. And that is in the meeting materials, and it is item number 6, correct?
Yes, that's correct.
Okay. I'm really just trying to open the PDF. I'm sorry.
That's okay.
Okay, I'm happy to let the members know
Thank
that up to this point, there have been no midwifery related legislation introduced. And the members may be aware that the board's sunset bill, Senate Bill 815, was passed, and that extended the medical board's sunset date for another 4 years. And, you know, unfortunately, the Senate did not include the midwifery becoming an independent board through this sunset bill. But as Ms. Weisner indicated, that is something that the medical board supported. And happy to answer any questions on the update.
Thank you, Ms. Webb. Ms. Freeman?
Yes, just wanting to clarify what was just said. You said that the medical board was supportive of the midwifery board becoming independent, or an independent midwifery board, but that was not supported in the sunset bill. Is that correct? Did I hear you correctly?
Yes, you did.
Reason being that to have a midwifery board, you would need a sunrise of a new board, so it would require completely separate legislation. I don't think there's any way for the medical board to work in the sunrise of another board in their sunset review.
It was a legislative change that the board requested that the legislature make, and the legislature declined.
Do we have any other comments from MAC members? Or perhaps public comments?
Q&A window and the hand raising feature active for anyone wishing to make a public comment. Give you a few seconds here to queue up if interested. Not seeing any requests at this time, Ms. Weisner.
So now we are skipping again to agenda item number 8 for a program update from Ms. Moriarty.
Yes, thank you. Please turn to page 8A1 for the midwifery program licensing statistics. In the third quarter of the 2022-2023 fiscal year, the board received 7 new applications, issued 7 new licenses, and renewed 60 licenses. In the fourth quarter of the 2022-2023 fiscal year, the board received 6 new applications, issued 10 new licenses, and renewed 67 licenses. In the first quarter of the 2023-2024 fiscal year, the board received 11 new applications, issued 11 new licenses, and renewed 53 licenses. In the second quarter of the 2023-2024 fiscal year, the board received 5 new applications, issued 6 new licenses, and renewed 72 licenses. Please turn to page 8B1. In the third quarter of the 2022-2023 fiscal year, the board received 52 transfer of planned out-of-hospital delivery to hospital reporting forms for licensed midwives and received 58 in the fourth quarter. In the first quarter of the 2023-2024 fiscal year, the board received 54 transfer of planned out-of-hospital delivery to hospital reporting forms for licensed midwives and received 48 in the second quarter. Please turn to page 8C1 for enforcement statistics for licensed midwives. In the third quarter of the 2022-2023 fiscal year, the board received 2 complaints and referred 0 for investigation. In the fourth quarter of the 2022-2023 fiscal year, the board received 5 complaints and referred 0 for investigation. In the first quarter of the 2023-2024 fiscal year, the board received 8 complaints and referred 2 for investigation. In the second quarter of the 2023-2024 fiscal year, the board received 6 complaints and referred 1 for investigation. Please turn to page 8C2. The board received 0 complaints in the third quarter and 1 complaint in the fourth quarter of the 2022-2023 fiscal year for unlicensed midwives, and 0 were referred for investigation. In the first quarter of the 2023-2024 fiscal year, the board received 1 complaint, and in the second quarter, the board received 1 complaint for unlicensed midwives, and 0 were referred for investigation. Please turn to page 8C3 for enforcement statistics for transfer of planned out-of-hospital delivery to hospital reporting forms for licensed midwives. In the third quarter of the 2022-2023 fiscal year, 2 reporting forms were referred for investigation, and in the fourth quarter, 0 were referred for investigation. In the first quarter of the 2023-2024 fiscal year, 2 forms were received for investigation, and in the second quarter, 0 were referred for investigation. Please turn to page 8C4. For the third quarter of the 2022-2023 fiscal year, the board received 0 transfer of planned out-of-hospital delivery to hospital reporting forms for unlicensed midwives, and 0 were referred for investigation. In the fourth quarter of the 2022-2023 fiscal year, the board received 1 transfer of planned out-of-hospital delivery to hospital reporting forms for unlicensed midwives and referred 1 for investigation. For the first quarter of the 2023-2024 fiscal year, the board received 5 transfer of planned out-of-hospital delivery to hospital reporting forms for unlicensed midwives and referred 2 for investigation. In the second quarter of the 2023-2024 fiscal year, the board received 5 transfer of planned out-of-hospital delivery to hospital reporting forms for unlicensed midwives, and 0 were referred for investigation. Please turn to the 2022 California Licensed Midwife Annual Report Summary. For 2022, there were 592 midwives expected to report. Of those, the Department of Healthcare Access and Information received 465 reports, leaving 127 licensed midwives that did not report. The total number of clients served as primary caregiver during this calendar year was 8,226, an increase of 250 from last year. The Number of clients who left care for non-medical reasons was 453 compared to 413 last year, an increase of 40. One set of multiples was reported, and page 4 indicates the number of planned out-of-hospital births at the onset of labor was 5,550 compared to 5,354 last year, an increase of 196. The number of completed births in an out-of-hospital setting was 4,697 compared to 4,511 last year, an increase of 186. Pages 11, 12, and 13 identify the outcomes per county in which birth, fetal demise, or infant or maternal death occurred. The number of deaths for fetal demise reported in 2022 was 17, an increase of 4. And the number of infant deaths reported in 2022 was 9, an increase of 5. And I have an LMAR update for you. On January 18th, 2024, the board mailed the LMAR reminder letter to all current licensed midwives. On January 22nd, 2024, the board also emailed the LMAR reminder letter to the email addresses on file for all licensed midwives. On June 21st, 2023, the board mailed a letter to the current licensed midwives that did not have an email address on file, reminding them to update their email address, as the board will be transitioning to a paperless process soon, and all notices will be emailed to the address on file, including renewal reminders and continuing education audit notifications. Per Business and Professions Code, Section 2021D, all applicants and licensees were required to provide an email address to the board no later than July 1st, 2022. Thank you. That concludes my update. Are there any questions?
Ms. Weisner, if I may, I just want to make sure, especially for new members, that it's clear that the number of that the matters referred or not referred to investigation may not align with the number of complaints received. It may be from a different fiscal year. And so if there's a question about why wouldn't there be a complaint referred for investigation for unlicensed practice, it could be it's still being reviewed, or that it didn't actually warrant a referral. So it doesn't correspond exactly to the number of complaints received.
Thank you for that clarification and for that report, Ms. Moriarty. Do we have any other comments from the members or questions?
That was just information, right? We don't have any input on any of the claims or cases, right? That was just information.
We do not process any of the investigation, enforcement, disciplinary stuff here at all.
All right.
Do we have any information about the time, like the average processing time for such complaints? Like how long does it take to get referred to enforcement or referred for investigation? Is any data being collected on that?
I don't have that information. I believe the enforcement presentation at the next meeting, you can ask that question and they should have an answer for you.
Thank you. Do we have other comments or questions from the members? Public comment?
Is anyone wishing to make a public comment? The Q&A window and the hand raising feature enabled. Give you a few seconds here to queue up. Remember, you don't have to type in the whole question in that Q&A box. You can just type yes or anything you'd like, and we'll call on you that way as well. First up here, we have Rosanna Davis. Rosanna?
Yes, I don't remember the previous conversation about what instigated the enforcement to do a presentation for us, but just want to put it out there that it would be really helpful to have information presented about the nature of complaints so that we could, as a profession, potentially see if there are quality improvement measures that could be made. Thanks.
Thank you for your public comment. At this time, not seeing any additional requests in queue.
Awesome, thank you. Moving on to agenda item number 9, which was going to be the selection of one new MAC member, as we have a vacant public member position. Ms. Moriarty, would you mind proceeding with the update on that?
Yes, thank you. In January 2024, the Medical Board posted a recruitment announcement on its website for one public member position on the Midwifery Advisory Council. This position is for a 3-year term that will expire on June 30th, 2027. The board did not receive any applications for the public member position that met the requirements for consideration. This position will be re-advertised on the board's website after this meeting. Thank you.
Thank you. Do we have any member comments or questions? Public comment?
Hand raising feature in the Q&A window open. Anyone wishing to make public comment, we'll give you a few seconds here to queue up. Not seeing any requests this time, Ms. Weisner.
Awesome, thank you. Moving on to agenda item number 10, the election of MAC officers. It's election day at the MAC here, and I'm wondering if there's a nomination for vice chair of the council. Oh, I have one. I have a nomination for vice chair of the council. I hereby nominate Mason Wilson Tanev as vice chair of the council.
Second.
We didn't even need a second, but thank you. I'm sure we all would. Shall we do we need to do a roll call vote on that one?
Yes, we do.
Thank you.
Faith Freeman.
Comment?
Oh, sorry.
Thank you. The Q&A window and hand raising features are active for anyone wishing to make a public comment. We'll give you a few seconds to queue up.
Any comment from members?
Will there be a something sent out with like the responsibilities of this position? I'm assuming Mason knows what is going on, but for us new members who have no idea what's going on, what all does that entail?
That's a really great question. And I no clue. No clue. No.
I'm happy to help out. It basically
Ms. Webb can help out.
Ms. Weisner was not available to lead the MAC meeting, then the vice chair would step in to do that. And if Ms. Weisner was not available to present at the medical board meeting, then the vice chair would do that as well.
Thank you.
And Ms. Weisner, you may want to just double check to make sure that there are not any additional nominations.
Do we have any additional nominations for vice chair of the council?
I would like to nominate Faith Freeman.
Awesome. Shall we put it to a vote, defer it to the next meeting? What would you all like to do?
Just for the record, there's no request for public comment at this time.
Thank you. Would each of you like to say something? Would each of you like to say if you don't want to be nominated?
Thank you, Ms. Weisner. I'll step in. As a new member, it would be my honor to serve as vice chair. Thank you for describing what the duties are. Ms. Robertson, I think that as a new member, I'm still learning too, so I appreciate your clarifying question. That helps me. I feel capable of standing in for you should you be unavailable to present, and working closely with you to make sure that the MAC has clear goals, a clear mission statement, and or more organization is what I'm hearing you ask for. So that would be my honor. And if this isn't the right time, then I look forward to working with you in any other capacity.
I would also be very honored to be elected as well, and I'm very excited to start this journey with the MAC and really interested in learning so much today, as Tamara also said, and Mason, just as a new member, learning what the MAC is doing, has been doing, and goals for the future. I am also would be honored for this position and feel quite capable, but am excited to join and be a part in any capacity as well.
I recommend when you take the roll call vote, just vote by stating the name of the person you're supporting for the position.
Thanks, Ms. Webb. I would like to begin a roll call vote for the vice chair of the council, and I'm going to go,
Ms. Weisner,
we do a, yes, what?
I'll call.
Thank you.
I'll call. Thank you. Faith
Thank
Freeman.
you.
Faith Freeman.
I'm just not clear on guidelines and voting protocols. Do we vote for ourselves? Is that appropriate? If that could be.
Yes, you can.
Yes, you can.
Yes, you can.
All right. So Faith.
Thank you. Dr. Kenneth James.
Faith.
Tamara Robertson.
Faith Freeman.
Mason Wilson Taneb.
Jason.
And Madeline Weisner.
Faith. Yeah.
Thank you.
Thank you to everyone for your willingness to take on this very heavy burden. And do we have a motion? The motion carries for Faith to be our new vice chair. Sounds like it, right?
Yes, that is correct.
Okay.
Yes.
Cool. Congratulations. And I suppose we're moving on to agenda item number 11 here. Congratulations. Discussion on birth certificate and social security registration issues. My understanding is that it's still a mess for licensed midwives, particularly when it comes to social security enumeration. I hope and pray Rosanna feels like calling in to give her public comment, as calm as who has been collecting information regionally about vital records and about social security enumeration. So hopefully she feels like chatting about that. Do we have any intel from MAC members on this and what you've experienced in your regions, your practices? Ms. Wilson-Tenev.
Liz, this continues to be an ongoing issue in the counties I serve, where different offices of vital records have different signatory requirements, and not all midwives are going in to hand sign their birth certificates. I think that this is a well-established issue. So any demographic data taken from about out-of-hospital births taken from birth certificates are not reflective of the safety and scope of midwifery. There definitely needs to be some kind of statewide consistency, and this has been an ongoing issue that I remember working with the department on after 9/11, when we lost the ability to write birth certificates ourselves as midwives. So this continues to be an issue in my area. Social Security offices typically take each family 2 to 3 trips, because each Social Security staff member is able to determine what accurate, what's the wording that they use, adequate identification is, sometimes requiring circumcision records, vaccination records, baptism records, even, and not necessarily taking proof of pregnancy signed by a licensed midwife or even a birth certificate as legal identification. So again, this continues to be problematic, and I think it favored in bias against midwives by the Social Security office. So that's a report from my area. I don't think that that is an experience. I happen to know that's not an experience that is exclusive to my practice. That is extensive in the 3 counties I serve.
Thank you. I'd say it's a pretty that's pretty on brand for Sacramento and the surrounding counties as well. In my practice, we've seen pretty clear distinction of how easy it is or how difficult it is based on the race of the family, and that is no surprise and is also extremely disturbing. Sacramento offices do cite like the county sheriff, what the county sheriff has to say about Social Security. I know that in other parts of California, there are more common concerns about Homeland Security and migration with Social Security enumeration. So I would say that it's a statewide issue, absolutely, and there are variations based on geography, but also based on based on a lot of different demographics of the clients that we serve, and the issues are increasing, not decreasing. As I said, I'm sure Rosanna has a little bit more information if she is going to make a public comment. Do we have any other comments or questions from the members about this? Okay, we can move to public comment.
The Q&A window and hand-raising feature available for anyone wishing to make a comment. First up here, we have Rosanna Davis. Rosanna, let me get that request sent to you. You should be seeing that.
Yes, Rosanna Davis. My only update with this is to confirm that, yes, an informal survey from midwives around the state is that, as Madeline and Mason outlined, those are the typical problems. My only interesting update is that I did get a chance to connect with the state registrar, and so now they're aware of these issues. It was the inconsistency. I found it interesting that she used the language of underground regulation, the way that the individual registrar offices decide for themselves in the absence of any, clear and definitive guidelines, what kind of identification they'll accept, whether or not they need a note from a doctor, hospital records, and that sort of thing. Anyway, she has put me in touch with some other folks in the agency, so that we might potentially work together to come up with some solutions at the state registrar level. And she confirmed that, you know, they just have absolutely no authority or sway with the Social Security issue because it is a federal issue. My recommendation has always been that as a profession, we figure out a way to, as individual licensed midwives, to be consistent from midwife to midwife, how we help facilitate the Social Security enumeration. So please watch for CALM to come out with something that we can distribute to all the midwives. So there, we have an outline for such a plan.
Thank you. Do we have other public comment?
Just double checking the Q&A window here, but no, I do not see any additional requests at this time.
So, thank you. Moving to agenda item number 12, discussion on midwife access to screening equipment for newborns. We have a growing number of midwives who are considering offering hearing screening to newborns. And I'm interested to hear from the MAC membership if, you know, what your thoughts are on that, and if MAC can provide a recommendation to the medical board to communicate to other state agencies or entities that that it's a good idea for us to be screening our newborns for deafness and hearing loss. So I'm interested to hear from anybody else on that. Ms. Wilson-Tanev.
Thank you. I am going to just assert that hearing screenings are vitally important, and that allowing midwives to conduct them at home would not replace those people who choose to have the hearing screen done by an audiologist or their pediatrician, but would capture those families who are opting not to have it done because of either a political aversion to going into medical systems, or maybe financial burdens to care. So this would really be in addition to this screening that is already being done, rather than replacing the screenings that are being done by audiologists, pediatricians, or other providers. This is capturing a population who is now not being captured.
Ms. Freeman.
Yes, I would second everything that Mason just said, and also just also note that I have practiced in other states, and it was equipment that was provided through the state midwives to access, and it was a huge benefit to those families that otherwise would not provide that for their, be able to provide that for their children.
Thank you. Do we have other comments from MAC members? I know that regionally we rely heavily on a nonprofit audiologist to do our screenings, and it's incredibly burdensome to them. They're sweet and wonderful, but it's the administrative burden is pretty out there, as well as the billing for Medi-Cal. So if, you know, in an ideal and perfect world, CDPH would provide hearing screen equipment and training and add us to the list of providers that can safely administer these screenings, because it's a part of the standard of care. So I'm wondering if the MAC would be interested in really strongly encouraging the medical board to say something to CDPH, if that's within our capability. about adding hearing screening for community midwifery providers. Do we have thoughts on that? Is there a way we can do that?
Ms. Weiser, could we issue a recommendation report based on what Ms. Freeman's experiences were with other states?
I think that we can, like, that is good information. I do not know if we can actually issue a recommendation outside of the MAC chair's report to the medical board. I don't know if we can give them a written proclamation. A written can we resolve? Can we have a resolution? Can we?
Can I ask a question about this, Ms. Weisner?
Yes.
When are screening tests typically done for newborns?
For babies born in the hospital, they are performed before discharge, so usually within 24 hours of life. And for a baby born in a community setting, if they want a hearing screen, they have to right now either show up at the hospital, which is the opposite of what our clients want or will do, or they need to find a community provider, of which there are just a handful of audiologists, fewer even, who take Medi-Cal. So it's well within the time period when we are giving routine care to those babies. And this should be part of that routine care. It's absolutely the community standard for newborn care. Ms. Freeman.
Yes, I just wanted to ask a clarifying question. Is it not within our scope right now, California, or it's the cost of the?
I am really sorry, Ms. Freeman, but your whole comment just bleeped out. I was wondering if you could repeat yourself.
Yes. Are you able to hear me now? Okay. I just wanted to ask a clarifying. Is hearing screening not within the midwifery scope currently, or it's just prohibited because of the cost of the equipment?
Right now, licensed midwives are not on the list of eligible hearing screen providers through CDPH. And that is not, as far as I know, that's not statute. That's like their health code rules, regulations. So, and as you know, licensed midwives currently don't have regulatory clarity on certain components of the practice that we have. Any reasonable person would look at this and argue that it's well within the scope of a midwife, it's within our core competencies. Most of us have been trained to do it, or are at least signed off on a clinical competency in theory. And in other states, you're in trouble if you don't do it or don't offer it, you know. The machines themselves are, as you know, cost prohibitive. The last time I looked at one, it was like $5,800 for the like very bargain basement one. So in addition to being allowed, we would need some sort of programmatic change to fund this, which I do think that the MAC should be lobbying for. That's an easy win, is the way I see it. It should be an easy win.
It's a question I have is that is this such a need for the licensed midwives to be able to do this? Does that mean that most of your clients are not going to the pediatrician? End of story. And then if they don't go to the pediatrician, why would they even want to do a hearing test then? Because I know every hospital I've worked at has outpatient access to anybody for midwives that deliver out of hospital. Kids can come in and get bilirubin testing, and they can get cooling blankets, et cetera. So, I mean, there's a lot of access. Plus, there's a lot of clinics that take Medi-Cal or walk-in, et cetera, or you can even go probably, I don't know if you can go to the ER to do it, but there's always seems like a lot of access. So the question is, if your client's not going to go to the pediatrician anyway, do they even want the hearing test?
Most clients that I've worked with have wanted hearing tests and have been unable to access them in their local hospitals and outpatient clinics. Most clients do not want pediatric care because licensed midwives provide routine pediatric care for the first 6 weeks of life. And that's appropriate. That's appropriate and reasonable. I do want to push back a little bit as a Medi-Cal provider, as one of the only Medi-Cal providers in this region. It is like pulling teeth to get anyone in for anything in Sacramento, especially if it's referred by a midwife. If anything, children are treated punitively a lot of the time for their parents seeking appropriate care. So if someone were to have an abnormal hearing screen that we perform, we would be referring them to a specialist. We wouldn't be referring them to routine pediatric care. We can skip that part and refer them to audiology or to speech or OT or whatever it is that child needs from an abnormal screen, but it's an inappropriate solution to say, oh, you can just send them to the hospital or to the ER or to the outpatient clinic. That's never going to happen. It's impractical, but I'm sure Ms. Wilson-Tanev has more feedback on that.
I just want to second what you said, Ms. Weisner. I wish it were that easy, Dr. James. We certainly would not have a need then for licensed midwives to be providing the service if the services were accessible, paid for by insurance, and could be done in a timely fashion. Most midwives I know want this service provided before 6 weeks of age. That's when when I understand from the audiologist that it's easiest. That is when those babies are in our care. Sometimes they see their pediatricians, but most pediatric offices don't offer outpatient audiology services. Occasionally one or two will, but usually that's done by the hospital or by audiology experts. And in those cases, again, as Ms. Weisner has said, a lot of our families are not going to go into hospital outpatient services to have this done, or will kind of drag their heels, and sometimes they just forget, to be honest. Whereas if their midwife were going to provide it for them and make it part of the care that we could bill for, we would capture so many more of these babies who are now not being screened.
I'm wondering if we have an option of any communication with the medical board outside of my report to the board at the quarterly meeting. Ms. Webb.
This is something that I think is going to require additional research and to understand what CDPH requirements are. And so you'd be free to put it on a future agenda where hopefully we can get some more information about, it seems like another state entity is involved in this, and we need to get more understanding about how that works.
Cool. Awesome. Thank you. I know the ideal is always for us to just all get in a room together and figure it out, and that's not how this works. So, okay, so we can keep that in mind when we're choosing our agenda items for the future. Let's see. Did we have any public comment on this agenda item before we move on?
Hand raising feature and Q&A window open. Anyone wishing to make a public comment? Go ahead and queue up now. Give everyone a few seconds. Not seeing any requests at this time.
Okay, thank you. Moving to agenda item number 13. Discussion and possible action regarding 2024 Midwifery Advisory Council meeting dates. What are the dates that we have laid out, or the date ranges?
The first two dates to choose from are May 30th and June 6th. Those are their first two dates to choose from.
And do we have any special requests from any of the members about which of those dates works better? Or public comment on that?
Weisner, I suggest, Tanya, do you want to share the other possible dates, and then you can do member comment and public comment, and then motion on the slate.
Okay, so the whole slate at once. So we have,
Like, you pick one from the first group, one from the second group, and then
all right.
make a motion to approve those dates.
All right, so for the first group, we have 5:30 or 6:6. What are our options for the second group?
The second meeting choices are September 12th and September 19th.
All right. Wow, okay. And what would the members like to do? The slate is of 2 meetings, correct? Okay.
Correct.
I like
Anyone?
May 30th and September 12th.
Some.
Agreed.
Totally. Shall we does anyone not want that? Shall we vote?
Public comment.
Yeah, hand raising feature and Q&A window open for anyone wishing to make a public comment. Give you a few seconds to queue up. Not seeing any requests at this time.
All right. So it sounds like the MAC is recommending the 30th of May and the 12th of September. Shall we have a motion to approve the suggested 2024 MAC meeting dates? I'll make a motion. I did it. Any 1 second?
Second.
Thank you. Ms. Moriarty?
Freeman? Yes. Faith Freeman?
Yes.
Dr. Kenneth James?
Yes.
Tamara Robertson?
Yes.
Mason Wilson Tanev?
Yes.
And Madeline Weisner?
Yes.
Thank you.
The motion carries. All right, moving to agenda item number 14, future agenda items.
Really quick, I have a question about the future MAC meetings. Are they safe to assume that they'll all be virtually, or at some point will they be in person?
The plan is, because this is an advisory council, that we can do them virtually under the Bagley-Keene Open Meeting Act, and that so they will continue to be virtually as long as we're allowed to do that under the law, probably.
And just to be clear, the Open Meeting Act allows 2 MAC members to be on a task force together. Anything over that, then that's against the rules, right?
Yes, that would require an agendized meeting with notice going out to the public 10 days ahead of time at least.
Great. Awesome. Okay. Our future agenda items, everyone. First, standing agenda items. Let's see where my list is for that. Do I have the list for that? Do we have any suggestions for future agenda items that are not always at the meeting? Ms. Wilson Tanev.
Thank you. I'm not certain if this is a standing agenda item, but per your request earlier that the MAC have a goal statement, charter, or mission statement that is more clear, rather than have this be a standing discussion at each meeting. And I propose that there is an agenda item. I'm not exactly sure how to go about voting on this. Is this a thing where 2 people could make a task force and bring that to the MAC and then have it voted on next time?
This is interesting because, you know, the purpose of the MAC is already established, and the MAC couldn't make a statement that, you know, it expanded its role in some way beyond what was allowed under the law and approved by the board. So I'll let you carry on just with that caveat. There is an administrative procedure manual, and as part of orientation, that will be gone over. So with that, I'll let you continue.
Okay. So what that sounds like is a future agenda item would be the assignment of a goals task force. And does that sound right?
Well, if what I'm hearing from Ms. Webb is accurate, then the Midwifery Advisory Council's mission is already stated as it develops solutions to various regulatory policy and procedure issues regarding the midwifery program, including challenge mechanisms and examinations and on and on. So it doesn't sound like that's actually open for discussion, and that any clarity might need to be by the members, for the members, rather than a stated something that we could state and bring to the board. But if there's room for another agenda item, I think it would be really wonderful to get some clarity about what other states are doing and have a report from the vice chair to the chair next time about audiology, the state of audiology in other areas, and how we might be able to communicate that to the board either in the chair's report or through some other reporting mechanism.
That's a fantastic agenda item. Can we add that? Shall we develop a slate of agenda items and vote on them all at once? Perfect. Okay. So
You don't have to vote on these. You can just
perfect.
brainstorm your ideas.
Awesome. Cool. And we already have a future agenda item of the enforcement process.
Correct.
We already have a future agenda item of, or a standing agenda item of all the licensing statistics, hospital reporting forms, midwifery related legislation. Took care of the goals thing. A future agenda item I would like to propose is to have a presentation from the Midwifery Learning Collaborative. And I can reach out to them about that. No. Do we have any other proposed agenda items from the members? Shall we proceed to public comment?
The Q&A window and the hand raising feature enabled for anyone wishing to make a public comment. Just go ahead and type anything in that Q&A window or raise your hand. First up here, we have Rosanna Davis. Rosanna, you should be receiving that prompt.
Yes, thank you, Rosanna Davis. I would like to request an agenda item to have a presentation from Melissa Cheney, researcher and professor who was commissioned by Calm to do research and a report on the licensed midwife annual report and make recommendations for improving it so that it could be used in research and or for quality improvement.
Thank you for your public comment. Just checking here, Q&A window. Go ahead and Carla Michael, let me go ahead and send you that request here. Give me just a second. Okay, Carla, you should be receiving that request on your end.
Yes, my question for the next agenda, could we review how members are selected so that if there's any public people on, they can understand how leadership is chosen?
Thank you for your public comment. This time, Ms. Weiser, I'm not seeing any additional requests.
Awesome. Thanks for the public comments. Sounds like the agenda items that we would like are a presentation on audiology, presentation on the Midwifery Learning Collaborative, presentation from Melissa Cheney, who's a researcher commissioned by CALM to provide insight into data collection in California licensed midwives, as well as an agenda item discussing how members of the Midwifery Advisory Council are selected. Sound good?
Ms. Weisner, can I go ahead and go through what I have just in case
I'd love that.
we're missing something? Okay, so standing agenda items are approval of minutes from this meeting. We'll have your report, the report from the chair. Did you want to keep, someone said something about a goals task force. So did we want to just keep goals on the agenda, or I know they had that as a standing agenda item previously. Did you want to keep that?
Do we feel that's productive? I'm asking the members. Or are the goals self-described in the description of the Midwifery Advisory Council already?
I raised it because I think there's a lot of repetition between goals and future agenda items.
Yes.
And so it's awkward because things that are requested and approved by the board get on the agenda, and the chair can create task forces to work on specific issues. So it's food for thought for you to decide what to do about that.
I think it's appropriate to assume that any agenda items are to the end of those is that we want to accomplish the goal set out by that agenda item. And so I would say we should can that agenda item of a goal setting.
And then I also have
Okay. Is that, am I crazy here? Like, it seems like make work, right? Okay, thank you.
If the goals are already elucidated, then they don't need to be restated.
Thank you. Okay, great, thanks.
Okay, we also have enforcement presentation. You wanted to keep the access to screening equipment for newborns discussion on that, or are we talking about the report on all audiology in the other areas? Is that the same agenda item?
Let's have the report on audiology in the other areas. And we don't need a standing agenda item for access to screening equipment.
Gotcha. Okay, and then we have the Midwifery Learning Collaborative presentation. We have the presentation by Melissa Cheney on the Elmar research and improvements, and a review on how MAC members are selected. Am I missing anything?
I don't think you're missing anything. I think
Okay.
these are all great. We do not have to vote on them.
No.
Perfect. Awesome. It
I do want
sounds
to
like,
clarify, Ms. Weisner, because
yes, thank
especially
you.
since we have new members, that just because a request is made does not mean that it gets on the agenda. And the board is particular about who comes to present at board meetings as well as MAC meetings. And so if it's unrelated to a state agency, there could be an issue with that being approved. If it's connected to an association, that could also be an issue. So we'll have to do some research on the requests, but I just want to manage expectations. But you know, they will be looked into.
Cool. Awesome. Thank you. Ms. Wilson-Tenev.
Thank you, Ms. Whitt, for that clarification, especially as a new person. My question is, could the Midwifery Advisory Council accompany that agenda item request with a justification for that agenda item and maybe a brief description of what's being asked of Dr. Cheney?
I think that's something that you can share with staff and for part of the research that will have to be done.
Okay, and I imagine that how that gets shared by staff will be involved. I'll get some information in the guidelines document that should be shared with me at some point.
Yes,
Okay.
Ms. Moriarty would be your contact person.
Wonderful, thank you.
All right. Sounds like the meeting's adjourned. So thank you, everyone. Really great to see everyone.
Thank you, everyone.